The U.S. Centers for Disease Control and Prevention helped the West African countries successfully end their Ebola outbreak a few years ago. At the time, the CDC was headed by Dr. Tom Frieden. He now leads a global nonprofit organization called Resolve to Save Lives. In a Skype interview, I asked him, how do you end the coronavirus epidemic that's going on now?
For each different microbe, we have a different approach. For some, we have vaccines. For some, there are containment measures like SARS or MERS or Ebola, where we can actually stop it. And for some, like flu, we try to mitigate. We try to reduce the damage.
With Ebola, finding people who had contact with those infected is critical. Ebola spreads through bodily fluids. Contact has to be close. Coronaviruses are airborne, like measles, which means these viruses can spread more easily through coughing or sneezing. This makes contact tracing a much more difficult operation. Isolation is also key.
Don't go out if you're sick.
But with a widespread virus that has infected at least 20,000 people, that can be a daunting task.
It's hard. It's definitely a really challenging public health question.
The Chinese government has asked people to self-isolate if they don't need hospital care. The government has also quarantined entire cities, which means people who are there are not allowed to leave.
It's a remarkable effort by the government of China, and in public health terms, we call something social distancing. In other words, reducing the amount of contact among people.
There are other things public health experts recommend repeatedly.
Wash your hands, cover your cough.
Everyone needs to wash their hands. Everyone needs to stay home if they're sick.
We don't have a vaccine for this one, and we probably won't for at least a year.
Researchers are working on a vaccine, but for this virus, the public health practices will likely end the outbreak, whether it reaches pandemic stage or not. It's what ended the Ebola outbreak in West Africa and some other pandemics as well. Carol Pearson, VOA News, Washington.